Explain the foot, skin and nail care procedure to the client before you begin. Help the client to remove their footwear. Carefully raise the client's feet into a comfortable position. You should be able to attend to the feet without bending down. Ask the client if they have any complaints about their feet, or if they have any pain or difficulty walking. Check the client's feet for signs that the footwear is tight or uncomfortable. Shoes or socks that rub or dig into the client's toes, feet or ankles can cause serious problems. Look out for red, swollen or broken areas of skin on the feet. Wash the client's feet. It is best to wash the client's feet daily using a mild liquid soap that does not dry the skin. Do not use a disinfectant. It can be harsh and drying. Rinse the client's feet thoroughly with warm water. Make sure that you rinse off all the soap from the client's feet. Any soap residue that remains on the skin can lead to dryness and infection, especially when it is left between the toes. Dry the client's feet. Some clients will require special procedures for drying between toes. The care plan may instruct you to gently swab the area dry using small pieces of gauze or cotton wool, while carefully separating the toes. Check the client's feet again. This time, you will need to look at the condition of the skin and nails. Look for any changes or unusual signs. If you notice anything different, record the information and report it to your supervisor or a podiatrist. Some clients have moisturizing creams massaged gently into their skin. This is done to prevent drying and to encourage improved blood flow. If the client agrees, check that the moisturizer is suitable for their skin. Use only a small amount of cream and wear gloves. Be very gentle when massaging the feet. If skin is too moist between the toes, this will lead to fungal infections. Avoid applying moisturizers between the toes, since this can lead to skin breakdown and infection. When medicated creams or lotions have been ordered, check that the correct client's name appears on the label of the cream or lotion. Check the use-by dates. Follow the instructions on the tube or bottle, and always wear gloves. Do not share tubes or bottles of cream or lotion due to the risk of infection. The client's care plan may provide additional advice. Medicated creams are prescribed and need to be signed off on the medication chart. You might be instructed to cover the treated area with a dressing or gauze to keep the lotion in place and to avoid staining clothes. Never apply bandages or dressings tightly, as this could restrict blood flow to the feet. Nurses or podiatrists are the only people allowed to trim or cut clients' nails. You may be allowed to gently file jagged or chipped nail edges smooth so that they do not catch on the client's skin or clothing. Never file the nails of a client who has diabetes or circulation problems. This should only be done by a podiatrist. File in one direction only, moving from the outer edge of the nail toward the inside rather than filing back and forth. Avoid touching the skin or filing the nails too close to the edges of the nail bed. Don't disturb the corners of the nail, because this can lead to infection or ingrown toenails. If required, you will need to clean the client's nails. Gently clean behind the nail using a single-use or sterilized nail cleaner. Avoid digging into or putting pressure on the nail bed, only removing dirt where you feel no resistance. Nail brushes can spread infection and damage the skin and should not be used. If dirt cannot be easily removed using a nail cleaner, nails can be left to soak in a warm foot bath to loosen trapped dirt. It might be best to add mild foot soak oils to the water to help this process. but check with your supervisor first.